Tennis elbow is a really common overuse injury that we see in patients that come to my clinic. The technical term for it is lateral epicondylitis. The extensor tendons that allow you to extend your fingers and extend your wrist have a common origin off of the outside part of your elbow. So lots of gripping, repetitive gripping, and grasping type activities can get that tendon origin aggravated. And really, when you look at the kind of microscopic level of what tennis elbow is, people often think that it's an inflammatory condition where the tendon is inflamed, or like a tendinitis type of a scenario. It's actually a kind of a microscopic mucoid degeneration of the tendon origin. Normal tendon tissue has elastic properties that allow for that tendon unit to elongate and stretch as you use your hand and contract as you activate those muscle units. And when you have this mucoid degeneration of that tendon origin, you lose those elastic properties of the tissue, and it creates excess stress on the insertion at the bone, which is where the lateral epicondylitis or irritation of that bony prominence comes from. And so when we're treating tennis elbow, we need to focus on multiple kind of facets of this problem as we address, the degeneration of the tissues, the inflammation or irritation of the bone, and the elasticity of the soft tissues overall. So I think that the majority of patients don't necessarily understand the deep origins of why it occurs. That has a direct impact on how we treat it. And physical therapy and some of those conservative measures are really, really effective at helping to alleviate some of those symptoms. I really encourage patients, to not get frustrated, but to really persist and be dedicated and diligent with their conservative treatment, because a lot of times we can get that to go away without having to perform surgery.